So today's post-op day 12, and unfortunately the drains are not emptying as much as I would like, which means I cannot take this out just yet today. Yesterday was 24, we need 2 days of sub 20. But today, we're not going to be talking about my recovery, because honestly, my recovery's been very smooth and fine. We're gonna talk about somebody who's just had a very large loose skin procedure done, and I think there's something seriously weird that's going on there. So, first off, as always, let's go weigh yourself to see how the water is coming off. 248.5, it's perfect. So there is another fat loss content creator that just received a very big surgery. He got, from what I could see in the video at least, I'm not sure the full extent of it, but he definitely got his chest done, the fleur de lis, and the abdominoplasty, which definitely looked circumferential by some of the clips that we're going to be seen later. Disclaimer, this is surgical content. There's gonna be some blood drains. I'm not gonna show anything too crazy like any skin flaps or anything or dissected body parts, but this is surgery content. Expect to see things that, if you don't like this type of stuff, maybe scroll away. So he goes by Garrett. He started at 550 pounds, lost 300 pounds down to 240. First of all, congratulations, buddy. That is an amazing, amazing amount of weight to lose. That's literally double what I did, so that's crazy. And Garrett got his entire surgery fully covered. I'm not sure what the extent of it is, but the way that he said fully covered, it sounded like that would have included the stay, the flights, the hotels, everything they're covered, of something called medical tourism. And to explain to you what my concerns are going into this video and some of the things that I'm questioning, you need to understand some pieces of information that I accumulated during my time studying medicine. So, the concept of medical tourism is not new, but what it is when somebody travels to another country for the sole sake of surgery. As an example, what I did technically was medical tourism. I flew into the United States, I got my surgery, and I came back to Canada. That is technically medical tourism. But there are certain countries that are more known for medical tourism. To give you another example, originally, I was first actually contacted by a medical tourism company in Colombia to go do my loose skin surgery there. And did not obviously pan out because I decided to go with Dr. Law instead. But some of the more named countries for medical tourism would be places like Colombia, Mexico, obviously the United States, but also countries like Turkey have been gaining a lot of notoriety for a lot of the hair that they'll do and loose skin procedures. And then obviously in terms of the benefits, well, it's depending on the currency where you're coming from, it can be cheaper, which is obviously a benefit for some that couldn't afford some of the pricing in their own countries. So let's say if you go to Mexico, the US dollar versus the peso USD is much more valuable, meaning that getting your surgery done in Mexico allows you to pay a lot less to get the surgery. And that covers the benefits, but there are a lot of risks. Mainly, if you are American, if you're Canadian, the biggest risk is that our medical care systems are not only incredibly well developed, but there are incredibly strict guidelines that keep doctors from doing certain things, or that only give them the power to do such things. In other countries, it might not be the case. And this goes from everything from what the doctor can do to the, let's say, just general sanitation procedures of the equipment, of the surgical room, of certain drugs that you're allowed to give versus not, the protocols behind those drugs, and general care standards. And what I mean by that is that there are different risk tolerance that certain countries will have that others might not. To give you a perfect example of this, Dr. Law is a great example of a surgeon that is one of the best in the world, but he opted not to do my 360 circumferential because of the risk from my Crohn's disease. But I'm willing to bet my left nut that if I would have went to some place like, let's say, Mexico, Turkey, or Colombia, where the doctor could have just said, that's fine, I don't really care, I'll do your surgery, cool. And you can just see right there how that could be concerning depending on the level of care that you're getting and maybe not a whole perception of what's going on. And I'm not talking shit, because there are some amazing surgeons in Colombia, Turkey, and Mexico, just as there are some amazing surgeons in the States and Canada. But there are also very bad surgeons in Canada, Mexico, the States, and Turkey and Colombia. And the problem is, if you don't have a good surgeon with a good place to do your surgery, with the proper equipment and technologies, and you are not in your country of domicile, you're not in your home country, you can get bankrupted by the fees that come from insurance risks if you get injured and you need actual emergency care post-op. If you develop an infection while you're out of country, imagine those hospital costs. Because I know that if you go to the States and that happens and I'm not covered, so I always got travel insurance before going to get my surgeries, of course, but if you are not covered, you can get bankrupted by some of these fees. So it really becomes a question of how much is your life worth? Because that's what you're gambling here. You're gambling your entire life, whether it be financial or just, being alive. Because if some doctors are willing to potentially cut corners on costs, on pain medication, these are all things that can really impact not only yourself and your surgery, but also your risk of surgery, without including the fact that your final results really depend on the entirety of the scope of care. We're gonna start going through Garrett's timeline, some of the videos that he posted, and I'm going to point out some things that made me question things, leading us to the actual reveal of his surgery, because this is what he looked like before, remember, and this was the result.
Holy shit. What? Where am I?
So those obviously the results from his surgery, and then he posted a video of his day 2 post-op, and that's when I got really worried.
What's going on, everybody? Just trying to show the whole process and the whole journey of skin removal, and it's hard, man. It's hard. This is the second time that they wanted me to get up and take a shower. So the process is they unwrap me, they undo all my bandages, they take off the compression socks, and people have to come in and help me sit on the edge of the bed, and I sit there for 3 to 5 minutes, and I was shaking, and I feel so weak, and I can't do it. I'm trying, and I want to do what they want me to do, because I want to be successful. I'm in so much pain, and I'm so tired. I haven't slept, and it's just...
And so clearly you can see this is a medical setting, either it be a hospital or a private clinic, or they do the surgeries there themselves. But regardless, in a medical center, you should be able to control the pain levels adequately so that you're not in a full-on crisis 2 days post-operation. And that means potentially one of 2 things is being missed. Either, 1, the staff are not controlling the pain adequately because of a poor pain management protocol, and this could be pain protocols will start prior to the surgery, leading into it, and what happens during the surgery is very important, and especially right after the surgery, what they give you. So without a comprehensible pain management plan, it is very possible that you might wake up looking like this in an incredible amount of pain, which for a surgery like this, I reached out to both Garrett's in the plastic surgery clinic, and nobody got back to me, but I asked them, did you guys use Exparel, which is a neural block that numbs you out for a full 3 days after, so that you don't feel pain at all. But not only that, most of the pain that you feel after a surgery actually comes from the inflammation. So was he given anti-inflammatory pills, or was it maybe just opiates? Because if you're only getting opiates, you'll still feel some pretty nasty stuff due to the pain coming from the inflammation. Or option 2 is that he himself is potentially playing it up. And I don't mean that in a malicious way. I mean, of course, we know that people will do absolutely fucking horrible things on social media to get some attention. But in his specific case, because this is still a very large surgery, what I mean by this is that, and again, I'm talking out of experience here, I've actually done this too without realizing it until after, when I sort of reflected on that situation. But after getting any surgery, and mine were for my colon and my rectum due to my Crohn's disease issues, I very specifically remember one time that the nurse kept coming to me in the recovery room, where she kept asking me, how's your pain? And I kept saying 10, 10. Every time that she would ask me, so she would give me a little bit more opiates. And I thought I was still in this incredible pain, even though I was actually just exhibiting what would be called a drug-seeking behavior at that point, due to the fact that I guess my brain really enjoyed getting those opiates post-op. right? So just something to look at here. So it might not be that he's just purposefully playing this up and crying and feeling all this pain, but it is possible that his brain was playing a trick on him, making him feel all of this even though he wasn't actually in pain. But it is very important here that I note that everybody will have a different threshold of pain. Both of you got very comparable surgeries, the 360 around the abdominal region, and then you got the chest done and the fleur de lis in the middle.
I was offered opiates, but I never took any. I didn't find them necessary.
What I was really confused about is the level of pain that Garrett seemed to experience. Because, like, in the second video, the next day, I presume, he is quite literally crying in pain.
I was very shocked, and it actually, like, it hurt me to watch the footage. Because one of the things I'm very I advocate about a lot is that this surgery is really not as bad as people make it seem.
And then
it's really not. And then they see that and they're terrified. And the surgery, at least my experience, and a lot of people have similar experiences to me, and they probably also had very good surgeons, where it's really not that bad. I was dancing in the streets at 3 days post-op, and he's barely getting up.
And then day 2, he slept good, and coming on to day 3 now, where he announces that he's actually going to be finally walking. And this terrified me, because I was up right away after my surgery, because you are at a higher risk of having a thrombose, which could lead to a stroke. I called you hours after your surgery.
Yeah, we spoke literally the night that I got out of the surgery, I remember.
You were walking around, like, right after your surgery.
The nurses had me up and walking within minutes of waking up.
Because of a properly made pain management protocol that starts before the surgery. Which is why you technically have to get up as soon as you can and start walking. So 3 days in bed, that means he was probably getting a very large dose of either a drip heparin, or he was getting some Lovenox or something of the sort subcutaneously. Make sure that his blood was thin. And then he goes on, walks his first steps. Really cool moment, of course.
Look at you.
Okay.
You just stay there. Okay.
Yep.
I'm gonna cry now.
Okay.
And I was a little bit surprised by this clip, because the camera should not take priority over the fact that this is his first time standing up and walking in over 3 days, meaning that there should be a nurse by his side and one behind him in case he were to fall. Client safety should always come first, even if having multiple nurses in the shot ruins your video. Because imagine if he were to fall after taking a step or two. Either he could hit his head, or he could be in a position where he were to rip open some sutures, leading to some worse scarring, or in a worse situation, having to go back into the OR. Like, I can't even imagine how amazing that must have felt, or maybe a little bit painful, but still. I do want to make note of something here, because so I have the forbidden juice boxes. This guy got the entire forbidden carton. And what I mean by that is there's different types of drains that can enter your body post-surgery, depending on the size of the surgery and the fluids that could accumulate. Mine are called Jackson Pratt drains. They're very small. It's like a little ampule that gets squished, and it goes up to 100 milliliters. Versus he has what's called a hemovac, which is the same concept. It creates negative pressure, except it's this thing that starts about this big, and you compress it down, and then as it pulls up slowly, it'll pull up these subcutaneous liquid that will accumulate up to 400 to 500 milliliters. So it's 5 times bigger than my little juice box. And so all this to say, when it comes to major surgery, I think it's really important that you take the time to evaluate what is your life worth, because that is in fact what you're putting in the hands of someone else. And if you choose someone that isn't necessarily looking out for your best interest, not only are you putting your own life at risk, but you are putting your body at risk, because the final results might not be what you were expecting to see. And that can be far more shocking than you would expect. I feel like I've seen like a bunch of botched jobs after obviously like being through like surgical TikTok. And it can be devastating to some people. Some people can get surgery and feel even worse about themselves afterwards than they did before if it looks bad, which is why, what is the cost of it to you? What is it worth? Once you answer that question, you'll know if something like medical tourism is worth it for you, or if you might want to stick somewhere where if there is complications, you might be in better luck. But regardless, Garrett, I wish you the best. That looks fucking sick. Hopefully we'll get to chat after this. I hope you don't take this in any way, shape, or form as an attack against you or the surgeon or the clinic. That was not the point of this video. It was more just to educate on the benefit, risks, and just some general evaluation as somebody used to work in healthcare. And I guess still sort of does as a weight loss coach. But as always, thank you guys for being here. I will see you all tomorrow. And as always, let's change the world together. I feel like my videos end up being like Marvel movies because at the end there's always like a little something, a little tidbit, whatever. It's currently 7:14 a.m. The video goes out in like under 2 hours, and the reason why I had to wake up this early because I got a text from Christian Guzman yesterday, and I just saw the text. I was like, holy shit. And then I gotta stop. I gotta chill. So I just stopped editing, went to bed, and I put my alarm to wake up at 6 a.m. to keep editing on this video. So I'm sure that's what I'll be talking about today in tomorrow's video.